This is an Italian-French guy, born in Italy, and then moved to France with his family. This is the engineer and inventor to whom we owe the production of such a device called Icoone. He worked for very many years in the company, the most famous French brand of vacuum massage roller. This is the man thanks to whom this brand took steps forward, developed, and improved. Well, a little over 10 years ago, Gianfranco realized what innovation he could bring, what he could change, and what a revolutionary step it can take to go to another, a qualitatively new level of technology. To get away from the vacuum massage roller technology and come to a new vision that will give better results, that can guarantee results in both aesthetics and medicine. So how did it all start, and what is the star chart that came together? Gianfranco at 2005, working as an engineer and researcher developer of technology and aesthetics. In the year 2005, met with Professor Gimberto. He is a French professor, a practicing surgeon, who is currently the president of our iTech Research Center for ICOM research. So, in 2005, this surgeon, this professor, published a very interesting scientific study regarding the functional unit of connective tissue, where we'll talk more about that. This is a very important aspect to explain to you exactly why we use the Icoone technology, why it's so and is unparalleled to date. This meeting led to 2008. Gianfranco Todico had a brilliant idea for a new vision, a new technology. It was named RoboDerm. Based on this technology, the first Icoone prototype was produced in 2008. And from here, the chain of the next steps of innovation begins. 2011 year is the face and body device. 2015 year is a combination of RoboDerm technologies with LED and laser technology, which we're getting excellent results from, and we're going to look at that combination a little bit closer. And in 2020, these studies, including the latest research with new technologies, the possibility of introducing skin sweat into the inner layers of the skin, microchambers of surgical operations, and at this moment of stimulation, thanks to the nozzles of RoboDerm technology, helped us to capture data, indicators that formed the basis of these innovations, which we will present to you today, and you will understand what new things have been done. To understand about what connective tissue is, why we're working with RoboDerm technology in the Icoone machine, we know that there's the traditional look, the mood of the skin, there's layers of skin, there's connective tissue. But few people have given importance to the functional unit of connective tissue that Professor Gumberto defined as the microvacuole. This is the unit that perceives mechanical stimulation from the outside and transmits it to the nearest cells, activating certain processes in them. RoboDerm technology uses different parameters in its operation. Its different power, its different depth, its different grip frequency. So it is different music in each program. You will be able to feel it when you come to the procedure and feel it on yourself. And this music, perceived by our microwaves, our connective tissue internet, activates a certain number of processes in the body. And we will see how this happens. Why is the Icoone technology, the RoboDerm technology, unique and unparalleled? Notice the unusual structure of the nozzles. What do we see inside the nozzles? There are rollers inside the nozzles, but actually they are not rollers. Yes, they are black inside. They're microstimulators. Why? Why do we say they're not rollers? The rollers are necessary to move the nozzle around the body, and the microstimulators are the functional unit of the nozzle. With the help of these pores, there is aspiration, suction, and we have aspiration and mechanical stimulation at the cellular level, at the point level. This is one of the key points of Roboderm technology. How are we fundamentally different from other vacuum massage roller technologies? In that, first of all, we have 1 in 3. It's a vacuum, 1 center chamber, 1 to 3 to 3. That is, it is a vacuum plus 2 microstimulators, which expand 3 times the diameter of the treated area, which can barge, turning off the central chamber and working with only 2 microstimulators, which allows us to work on damaged thin skin, sensitive skin, with capillaries, with varicose veins. It also allows us to do medical programs that treat certain pathologies, diseases, of the blood circulation, of the lymphatic system, and so on. We will go into more depth about that, of course, at this point. What else? What other things exactly are unique about the robot technology? The fact that we have an operator who can work with both hands at the same time. Why? Why doesn't any other technology in the world work with 2 hands at the same time? Because these microstimulators, this aspiration system gives us robotic attachments, which themselves already know where to go. You don't have to carry them around, but the operator just holds them and just helps them go where they need to go. They already know themselves what to do, at what frequency, with what power, and how to work the cells of our body. So the second point is that it gives us 2 hands at the same time. It automatically halves the procedure. That is, we approach twice as fast as globally. We always start with a basic program, and we love the whole body of our client, and we work it all in 20 minutes. And then we connect as many focus programs as we like. Why? Because it's a completely physiologic device, completely non-invasive. There's no shock, there's no pain. Our clients at the Icoone procedure are resting, sleeping. They feel so good. They get up, they are energized, they feel great. After the first treatment, they already look great and are satisfied. So what are some of the other things that we pay attention to? In 2015, we had the brilliant idea to combine RoboDem technology with 2 light sources. That is, we have built 2 light sources into one of the nozzles, the largest focal lengths. This is a laser invisible to the eye 915. Its main task is to recognize the fat cell and give it the impulse that without thermal shock, without the fact that there is something damaged, but simply activates the natural process of metabolism of this fat cell. We activate lipolysis, that is, we have Roboder mechanical multimicroviolar stimulation plus a laser. Plus we have added LED, which works very well with fibroblasts and stimulates collagen production. So what is collagen? It's young, tight, beautiful skin, and it's the combination of these 3 effects that give a kind of bullseye to our Icoones. I would like to invite you virtually during the quarantine period. We are all at home. I also have not seen our factory for a long time. I would like to visit it virtually. So, it turns out that I am representing the production factory of iTech. As of today, this is a company that manufactures Icoone devices, and through its distributor companies, through our colleagues, we supply them all over the world. Today, it's over 2,000 square meters of production lines. All the machines that we produce are manufactured, exactly tested, developed in our factory. We have very strict levels of control that have allowed us to get a very high level of certification and approval as a medical device manufacturer. So what you are purchasing is 100% made in Italy. Also, iTech is a company that is a focal point. It is a training center for our specialists and representatives of our distributors. That is, we are constantly exchanging knowledge, transferring information. We are interested in making sure that the center, which purchased the machine, receives first-class training, receives periodic trainings, advanced training. We gladly accept the results. It is the feeling of joy of the centers that use Icoone, who send us their results. We share experience. That is, we work in this system. To date, what is Icoone in the world? That is, today we are present in more than 30 countries of the world. Through our distributor companies, these are 4,500 centers and clinics around the world that are currently using the Icoone device. That's 6,000 Icoone treatments every year. That's 500,000 satisfied customers, satisfied with their results and their well-being all over the world. So who are our customers, the centers that use? Of course, they are primarily aesthetic centers. It's health and beauty. Why? Because Icoone perfectly solves problems related to cellulite of all stages. That is, we work on the body, on the face, on the décolletage. We work with the smallest nozzles on hard-to-reach parts. So we don't have any restricted areas on the human body that we can't work on. We also work on sagging skin, wrinkles. We work very well as a starting point. It's a great lymphatic drainage. We're going to talk about that today because we help these machines sometimes move patients off the dead spots. So we start the processes. We work with collagen elastin production and fat reduction in the body. As for the next segment, of course, it's clinics. These are clinics. This is exactly treatment prevention. Why is this interesting? Because Icoone is an indispensable assistant in preparation for many medical activities, operations, surgery. That is, it is preparation, so that a person can better tolerate what is prescribed by the doctor. He needs to prepare the tissues, to work, to eliminate excess fluid, to improve the condition. And it's a very good rehabilitation. But also, in addition, this is the device that treats problems related to the lymphostasis with vascular diseases. So it turns out that we work with scars and burns. Today I want to share with you the news that we continue our cooperation with the On Loose Iris Center. This is a Roman clinic. It's internationally recognized. It is known for the treatment and prevention of cancer. Icoone is widely used in the rehabilitation phase and functional post-operative recovery phase. So we give very good results in terms of healing wounds, removing swelling, removing hematomas, and helping a person to rehabilitate. And we are also very widely used in sports. Chiropractor, have a counselor, have a nutritionist, have ICU. So it turns out to be preparation for physical exertion and its post-physical exertion. We're good at getting lactic acid out of muscle masks. We work as an ambulance at the moment of injuries, sprains, bruises, hematomas, anything to get a person back in shape quickly so that they are 100% able to do what they love. Some literal results I would like to share with you. What we get at our factory. We have a scientific center where our operators and trainers conduct procedures and take readings before and after. This is a patient, 35 years old, 10 sessions, duration of 30 minutes. Once again, our philosophy is that we always start with a basic program. 20 minutes we treat the whole body, we start all the processes we need, and then here it was enough to have 10 minutes of focus program on the area that we are interested in. And we got this minus centimeters in 10 sessions, 3 times a week. I think that's a great result. We also kind of work the same way we do it for men. In Europe, Icoone is very popular. In Ukraine, I think it will be the next step, because men should be as beautiful women in Ukraine, because you have to. There is something to strive for to match. Talking about here were treatments twice a week. This guy, 36 years old, 10 sessions. 40-minute session duration, 20 minutes basic, and 2 focus sessions. So we worked through and we got this minus over 7 centimeters in volume, improved skin quality, and of course, improved health. I think men understand what we're talking about and kind of take it in amnion. One more point, I would like to emphasize that here this man is 42 years old. He has lost a lot of weight, a lot of weight. And yes, this is this problem of saggy skin. When you think what to do, maybe somehow, maybe surgical something, yes, advise. But it turns out we did 5 sessions, twice a week, and we came to this result. That is skin smoothing, collagen production, lifting, exactly improving the skin condition. Another Italian lady, 72 years old, 5 sessions, and we did them every day. Such a great result. Okay, 20 minutes is the length of the session. I would also like to emphasize that we are really indispensable for clinics that deal with surgery, plastic surgery. So it's the preparation of rehabilitation. At the moment, we are dealing with the consequences of a traffic accident, and we gave this patient 10 sessions every day. And in addition to what we were able to aesthetically improve, we also brought back functionality, because in the area of the eye, it was not closing. Already after the first procedure, a person was able to fully close and open the eye. And some moments of work with the face. That is, it turns out wrinkle smoothing, rejuvenation, recovery. The procedure of this patient, once a week, duration, 40 minutes. But once again, I would like to emphasize, we, of course, will talk about it, that all your clients who come to your center for Icoone procedure for a certain goal, that is, to improve the state of cellulite, to reduce in volume, they must understand, get a bonus. 3 effects at the same time. It's not just aesthetics, it's health. We trigger those processes at the cellular level that give you those bonuses in the future. In other words, I would like us to live better. I would like Icoone to become a way of life for each of us, and then the world will become more beautiful and better. This is the end of my speech. I would like to see Georgy Lebedenko speak in the next one. Say that the clinics where Professor Litskovsky, where the machines are, where Georgy has the opportunity to work, is one of the representatives of our scientific committee, the annual scientific committee, where we exchange knowledge, experience on the use of machines.
It's in my creative destiny that I combine both practicing medicine and executive medicine. So the headache when you buy a new machine, it's very familiar to me. And so with this question today, I will also touch on them a little bit. Just 1 second. I'm going to move on now. You can see my presentations. Yeah, great. Okay, well, I think we're basically not going to be the same. We'll be out with all the other new people after this quarantine, after this isolation. We have to understand what we are going to face as doctors, as specialists, and as business owners, as managers. And medicine, it has certain trends. As of today, we can say it's 5P medicine. I like to say it's 3P medicine. It's preventive, predictive, and personalized. The patients who come to us today, who request our consultation, who basically come to our clinic, are people who are very fond of the word prevent. Coming to prevent some kind of disease, prevent some kind of change in their body. They want it to be painless. They want it to be comfortable. Nastia said it right. They want their body to be loved not only by their relatives, their loved ones, but also by doctors, among others. That's our job. Predict. Patients today, when they come to our clinics, including for lymphatic drainage, they do not just want to have the procedure done, they want to know what is going on inside them, their body. They are very fond of the word chakapa. Some already come in with these tamudas and ask for some kind of interpretation, and that will further dictate the movement. Those who will understand how to implement Chakap and Icoone, they have done it themselves. Those will be at the top of the list, at the top of these patients who are young coming to us. And of course, personalized. People who come to see us, they no longer want any kind of formulaic things. They are not interested in that simply. They want the doctor to tailor the program directly to them. Icoone has been such a help to us because and this personalization, well, in Russia at least, huge sums of money have now been invested in healthcare so that medicine can be so finely tuned to the requirements of the patient and so personalized that even the drugs today, some, in the specialization of oncology, are already selected so that we know which drug will work in a patient who has this or that oncopathology. Personality is something that will drive us and our professions for a very long time to come, and personalization is a trend that we have to follow. But in addition to keeping up with some of the trends of our patients, we have to understand what, basically, the executive is going to need to do. My presentation is a little bit late, but I will overcome it all. So when we put some platform, a new machine in our clinic, we need to understand how we will basically do this, a service to sell. That's a problem that physicians face, that's a problem that managers face. So we have to. I know my presentation is a little bit off right now. And it's very important that the people who we have selling this service, that administrators also clearly understand that physicians who are allied health professionals also understand what we're talking about. And that's why it's very important for us to set tasks between the specialists who sell the service, what and how to do it correctly. Really like to talk about the new generation, people who are in this new generation, people like Z. I'm going to show you a comparison of what that looks like. Generation X, Generation Y, and Generation Z. A lot of people are going to quickly count who belongs to which generation, some to X, some to Generation Z. And I mean Generation Z are people from another planet altogether. It is just such with 20 years, who now come to our reception and start. These are people who were born already. If I have, came along at such a more conscious age, then these people love new technology. It's true. If we don't keep up with their trend, we won't be able to take a lot of clinic turnover, unfortunately. These are the people who come in and say, "Show me something new." She tried something new last week. Today she needs something new again. These are the kind of patients who are afraid of injections for some reason. That is, for them, to have something foreign come into their face or body, they do not like it. They like something new technology, something outside of Skolkovo. And new technology will always attract them. And the main thing is that it should be safe, that it should not be painful, and that it should be productive. And I always come back to this when I talk to doctors, so that they take into account all the nuances of the patient. Here's the IQ Med. I think Maria will tell you after me. She'll convince you. What a manager should do. Well, apart from grabbing your head, yes, and realizing, God, I have a new platform. What should I do next? You need to clearly understand. This is how we did it. We bought 3 Icoone machines. And you need to understand what the profitability will be for non-seasonal procedures. Although, in my opinion, lymphatic drainage, in principle, has no seasonality. Promotions, maybe. Especially when you start a new service, a new technology, you have to clearly understand how it can be implemented. Promotions are a great experience in history. Olia Kozelskaya knows this, how we intertwined between the different technologies that we have in our clinics. Seasonal discounts should definitely be, especially now, when we with this insulation, God forbid, do not roll out with our mouths on the floor. Yes, +4, +5 kilograms, for God's sake. These are all our patients and clients with you. There is basically nothing to the apparatus techniques, because the consumption is very, very low, and in this respect, body and face techniques will certainly help us very, very well. You have to clearly distinguish what the goals of the hardware procedures are. You should never smudge. We have identified 5 such basic criteria for you. You can fix them for yourself, yes, or you can watch this webinar again. It's going to be recorded. Enhancement of blood circulation is mandatory. Muscle relaxation. This is where a huge cohort of patients can be affected. Why? I remember from the course of physiotherapy, when we were in ultrasound, that when the task was to make lymphatic drainage massage with hands and apparatus, I have a clear phrase in my head, always choose the machine. Why? First, it will do it evenly. Secondly, the apparatus does not have any. It is not inherent in any emotional qualities. It will do it, or will do it, because that the operator is working, yes, that's important. And the apparatus will make the relaxation maximum, because not always the tactile effect. It is very pleasant to a person. Here you need to be very, very apparatus. Activation of fluid circulation. Well, first of all, based on physiology, every girl once a month has the right to draw water. And it does not always have to her in that period. Maximally, it is comfortable. Therefore, microcirculation is our everything. Sensitive fibroblast channel follows from that. Very motherly wording, I agree with you. But Anastasia already mentioned that these are the cells that give us collagen. Collagen is elasticity, indirect lipolysis of PJCs. I would like everyone to be desirable, beautiful, successful, while lying down and losing weight. This technique allows you to do that. I will prove to you in the study that we conducted in our clinics. Lying down and losing weight is a dream come true in general, especially the Generation Z patients that come to us to date. I want to share with you that study that we did with our colleagues in Moscow, with our colleagues in Italy. We showed this study, got very good results, and we did it in a simple way. There's no need to ban the bicycle. We evaluated what clinical effectiveness the technique would have. Patient satisfaction. Satisfaction is always very important to me as a physician. It is important for me that the patient has no questions left for me. It speaks to the quality of the healthcare delivery and, of course, clinical outcomes. That is such a double. 2 scales. When we evaluate both clinical effectiveness and effectiveness for the patient, What's the outcome for the patient is that they'll come back for this procedure. After 6 months, patients are coming back. So the technique is really effective, and I, as a leader, made the right decision by doing this study and recruiting these patients. So, there were only 10 people. We took before and after photos from the layout. It's generally head obval, before and after photos, how to do it correctly, how to do the archive correctly, how to prove to the patient. There are a huge number of programs for this. There are certain databases for this. I always say, the more photos, the better. Why? Because the patient always sees himself. And it is important to realize that when he says in 6 months or a month that the doctor, nothing works at all, your methodology is not good. Give me the chief physician here. We will stretch him on the cross. You give me my money back. You show me before and after pictures and say that the result is basically there. If there are any questions there, Anastasia, you can read to me so that in parallel, I can answer, okay? Bioimpedance symmetry. Well, as an internist, a person who loves metabolism, I like this methodology very much. Fat to water to muscle ratio. There's nothing more honest, because every tissue has a resistance property, and bioimpedance symmetry before and after will show us that after the methodology we have gone fat, water, or God forbid, muscle. We did 10 procedures and combined the basic technique, that is, lymphatic drainage and focus procedures, when we worked with a patient on certain areas, on those problem areas that he pointed out to us. You should always ask the patient, even if there is some research, what bothers them the most. Someone would say he was perfect, and we would point our finger and show him that he was not quite that, but kind of perfect. And what kind of results we were getting before and after. I'm going to show you 3 important criteria to base this on. It's certainly body fat mass, before and after. How did we do that? Bioimpedance symmetry. That's where we looked at how much body fat we had before, and how much body fat we had after. Notice that green is after, blue is before. A lot of patients have lost quite a bit in percentages. Yes, there are slightly different results, but also the initial body fat mass of the patients was completely different. But notice that almost all patients have lost fat mass. This is a dream. That's what the methodology allowed us to do. Of course, the body mass index. Absolutely everyone uses a calculator, and we can always read the BMI. And look that before the study, there was one figure. After the study, almost all the patients, they reduced their BMI. It was mandatory that these people were not on a certain diet, that these women were not taking hormonal contraceptives. Everything had to be honest. And they had the physical activity absolutely the same as they had before the study. So nothing really changes. Because we could do cardio so that basically the fat would go away on its own. That was our clear condition. And the patients signed papers that there was no cardio loading. And there's still a loss here. Perhaps now someone will throw a tomato at me. I will be ready for it. About what little loss. This is always where we have to realize who is in front of us. We have 3 morphotypes of patients, and we evaluate who comes to us for a body procedure including ecto, endo, or mesomorph. The ideal patient, I'm looking at it right now, someone is nodding at me, would of course be an endomorph. These are the people who gain weight quickly and take it off very hard. These are patients who on all methods of similar, especially on microalveolar circulation, will give you a great result. Even after 2-3 procedures, the patient will tell you that he already feels much better. Mesomorphs. I always joke that these are the descendants of those who were not burned in the Inquisition. They're the people who gain weight quickly and lose weight quickly. These are our most athletic patients. These are the ones that have a lot of physical activity. And there are some Olympic bases, it's true, that have vacuum roller massage, because the athlete needs to recover quickly. Ectomorphs are patients. When I talk to cosmetologists, I always talk about the volume of drugs we discuss. And I come to the patient, I say, guys, it's like dry land. No matter how much you put into him, he will still come to you in a month and say that you were lost to him. It's metabolic, and patients will always respond differently to any procedure. especially when we're talking about a body procedure. I'd also like to point out right away that Icoone is one of the few techniques that allows you to work with burdens. That is, girls who are in a great position, who are prone to swelling, who are uncomfortable. This method allows us to work with such patients, and this is of course a great help for them. But at the same time, look, the medial circulation of the lower extremities, the improved circulation in the legs improved in all patients in much larger numbers than body mass index and body fat mass. We're always going to have a little bit of that bias. We always see, even on biopediatrics, that one leg is better blood supplied than the other. Well, we're all basically a little bit crooked by nature, right? Plus, we sit with our feet up against each other. A lot of us are drivers. I mean, it's something you just have to understand and forgive yourself for. But the microcirculation in the legs improves after infodrainage. We even sometimes do Icoone biomimetics before and after. And there is already an improvement. Good lymphatic drainage is always a great help for the patient, and the microcirculation improves many times over after a clear, huge lymphatic drainage. The patient will remember this condition forever when he starts to have another such load, complicated, for various reasons, social, work, a small number of flights. Some people immediately from the airport call the clinic and say, "We are already coming to you for the procedure." This feeling will be filled forever. Well, let's play hospital. My favorite part. Yeah, I'm gonna show you some patients. I'll show you before and after. I'll show you two different girls. This girl is 50 plus. Look at her after 10 treatments, what a great result she's had. Even a little bit you can tell that her underwear fits differently. Especially the abdominal area. These patients are the most difficult. People with abdominal obesity, these are the people who always have fatty hepatosis. They will always have difficulties with liver metabolism. You always have to look at them from both sides, but also look at the profile. For me as a clinician, that's a great result. Of course the patient is satisfied, happy, and the most important thing is that we gave the patient an incentive that there is a place to move, that you can do your metabolism. Even if you are on a pause for the first time, it seems to you that life is over and it will never be the same again. On the contrary, lymphatic drainage will always give good results. The girl is more of a mesomorphic build, physique, but here she is just lazy. Yes, nothing needs to be said here. She was given good data by nature, and it was just necessary to put a couple of stitches in her mouth in time to prevent this condition. But at the same time, after 10 procedures, if you pump it up a little bit, already I'm even showing you now you want to do it again, to touch this density of the skin, this turgor which remains after the procedures, pumping it up a little bit, you can safely put it on the I think any competition that is. The patient is not that happy, she's just satisfied. My husband and all the other comrades who could appreciate the result. And Sergey has already touched upon the topic that in rehabilitation, we can also use infodrainage procedures, of course. There are certain goals after the surgical period, and goals for edema and pain. What is pain? It is first of all edema, which presses on the muscle and gives us pain syndrome. Infodrainage with good focus work with a certain pain zone. We will remove this pain syndrome. You can use it with different combinations, with taping, with different acupuncture. You can use anything you want. You can pick up the patient's port, but in this case, focusing on the pain point will be the first procedure that we should use on this patient. We've already talked about smoothing out the topography of the skin. Even localized areas give us a beautiful result. I would also like to show you an interesting case. This is to say that patients today continue to dictate terms to us. The fact that they want a procedure, even a large volume, which we used to do with you under general anesthesia, they want that it was not painful, quickly, so that the patient does not turn off in his consciousness. This liposuction that is being done now is so focused. It's the different areas and fat traps that we're working with. Here is a patient with pictures after the procedure. I'm going to show you what it was like before. and we did 10 treatments of 40 minutes every other day. That was the preparation for the surgery. Her rehab lasted practically 5 days. Here's the top is the before photo. This is the widow's hump. That's the withers that everyone doesn't like, which is always not pretty under a dress, which, if you wear some kind of sweater made of thin fabric, it will also be visible, and women are very, very upset about it, but it's a predisposition. We deprived her of this dowager and UGERB, and also shortened the rehabilitation period. After the liposuction procedure, they immediately taped her up, yes, and put her under compression garments. Look at that, there's almost no swelling at all. This shows that we removed the pain syndrome. We gave the patient a short rehabilitation. Of course, she came to us for further procedures. The post-operative period is minimal. This speaks to the versatility of the machine. And another very good protocol that we have is Icoone and Natevo lifting, even between the fingers to make everything beautiful. That being said, again, the patient is going in for such an application. I can't afford to fall out of life. I have to do the procedure on Friday and come back on Monday so beautiful that everyone will think that I just slept all weekend. These are the kind of requests that really exist. How do you do it? Prepare the patient. If he is ready for this short rehabilitation, then he should be well prepared for this procedure, and he'll be successful, and he'll be happy. Every day we have to prepare the patient. On Friday we start working with the patient on Monday. Small manipulations on the face, in various combinations of course, emphasizing lymphatic drainage. And the patient, by the way, already getting up from the couch after the procedure, she will already see that the volume seems to have gone. Maybe we don't need to do anything. It's just a temporary effect. It's a miracle of lymphatic drainage. And look, here liposuction was done at one time, and immediately on the 5th day, the lower jaw area, the submental area, which had not been treated much. If you look at the 3 photos that we have, the last photo was taken on the 7th day. There is already nothing, in fact, not a trace of it. This head chest that she had, we leveled it. It's gone and it won't be. And that's why it can also be done in your clinic. We do these procedures in the clinic. Or you have some kind of collaboration with a patient surgeon, so you can actively use it. Well, we have already gone a long way further. We were pushed by our colleagues from Italy, from Moscow, and now I know that we have colleagues in Kazakhstan and Kyrgyzstan who share their results. Lipfolite, book elevator, botulinum toxin injections. If it's a patient of that morphotype, heavy, and she's going to give you on botulinum toxin with a lot of edema, you can also lymphatic drainage with great results, especially if it's a primary patient and you need to win her loyalty. Give her a lymphatic drainage procedure, give her a good botulinum toxin, maybe in combination with other technologies or areas. As we like to do now in one session. Yes, our cosmetologists. Virtuoso literally. What they can do in one procedure, now we can only wonder, but about lymphatic drainage we will get less swelling, so that this patient then did not blow her brains out when the next day something swelled even more and bring it all back. With a good lymphatic drainage we're going to get a good result. And of course, with biorevitalization, chemical peels, mesotherapy, especially for the body. I generally like everything that concerns internal organs and the body, all the developments that can be used. And it's proven that body mesotherapy, even if you use lipolytics, will give you good results in combination with LED techniques, with lasers, and definitely with our favorite multi-nicoalveolar circulation. Now that was a shorthand contest because I was only 15 minutes in. I tried to keep the speakers of the rest of the audience on their toes. If there were any questions, I was ready to answer them. I tried to fit in my timing as much as possible and at the same time show you how much the methodology can really be evidence-based, effective, and can bring happiness, love, and delight to the patient.